Hello everybody. Welcome to the first episode of Four Corner Network. We are a new venture of four people who choose to bridge the gap between what we learn in theory and how we actually implement in the practical setting. So I am Debolina Roy and I have three other team members with me and we are the core group of FCN. So we can proceed with it. So I will ask Dimple to introduce herself.
Yes, hello everyone. I am Dimple Panchal. I am RCI registered clinical psychologist and also presently in teaching profession. I am practicing from past 5 to 6 years as well as teaching from 3 years. So that's about me, and my subspecialization is child psychology. I am interested in neurodevelopmental disorder specifically, as well as I can say I'm trained in assessment and diagnosis industry area. And recently I have started reading about positive psychology. So this is brief about me, and welcome to Four Corner Network. It's initiative that we started to bridge the gap between like what young students are learning today in the colleges and applying the same skills. So there is a gap between the same which we wanted to cater with the help of internship and all other programs that we are going to come up with. Yes. I'll give the mic to Shrita.
Hi everyone, my name is Shrita. I am a clinical psychologist by profession. I have been working on my private practice for the past about 5 years. Uh, Other than that, I'm queer affirmative and trauma informed in practice. I have also been in academia for about 2 years, but switched completely to practice eventually. As a matter of fact, all of us have been colleagues in the past. Before we became friends, we used to work in the same organization, and we started FCN with the intention that young psychologists need some more upskilling before they start practicing. So just to help bridge that gap, we've come together and we've introduced Four Corner Network, and that's how we are working. Can I please call upon Lipika ma'am to introduce herself?
Thank you, Shrita. So I am also RCI licensed clinical psychologist, just like my team members. I am also a PhD scholar. I'm doing my PhD in psychology, and I am also practicing. I'm practicing the clinical psychologist. Within the field of clinical psychology, my subspecializations lie within the domains of behavioral addictions, addiction disorders, depression, and anxiety. And I like Shrita and Dimple have mentioned, the reason why we came up with this venture is because we have noticed while teaching young students also, and students are going to become psychologists, we have noticed that there is a huge gap between theoretically what we teach them and practically what they go and apply. So we wanted to sort of bridge that gap and teach students the ethical ways to practice and what are the necessary skills that they need to practice. So, with that, keeping that thought in mind, we created this venture, and we are here today in front of all of you, basically to spread awareness about psychology at large, about the subfields of psychology and other related topics. So, yeah, that was about me. I'll now request Evelina to maybe introduce herself as well.
Yes, thank you so much, Deepika. So yes, I'm Debolina once again. So currently, I'm a practicing clinical psychologist. I'm also a PhD scholar. And as Sheeta has already mentioned, so we used to teach in the same organization. So we were in academia and still in academia, but majorly focusing currently on the clinical practice. So my research interest lies in neurodevelopmental disorders and emotional dysregulation. So today we are thinking, what do my team members say? So let us think about the current scenarios and the current trends in psychology in India. I would really like to know your insights on this, that where India is standing currently with comparison to its global counterparts. So what do you all think? What is our current scenario in psychology?
I think there is definitely some significant improvement post COVID, because it is during COVID that we've seen a sharp shoot in the rise of mental health practitioners and how much people accessed mental health because they were living together, they were going through unforeseen future. There's a lot of uncertainty. People were having a lot of problems in their marriages, in their family lives. They were discovering things about themselves because they had very little to do and very little access with the outside world. I've also noticed a very significant pattern among people who have been struggling with substances and addiction, because it was during the lockdown period that access was getting lesser and lesser, and they were struggling more and more with their problems. So yes, post COVID, I would say that the scenario has turned very, very much in our favor. India has become very much, upskilled in terms of mental health practice and mental health services. What do you
That
all
is
think about that?
that is
Yeah, I would agree with Shrita because ever since COVID happened, there were so many, I think, new things, like she said, that people discovered about themselves, and there were a lot more difficulties related to mental health, and there was job insecurity, and of course, the physical health was at stake too, and anxiety related to how people will recover from COVID and what happens if they catch COVID, what if their relatives catch COVID, and they were not able to visit their relatives who were sick, and those kind of things. So yeah, definitely that did put the entire topic of mental health into the perspective of the larger audience. And that is how a lot and lot more people started recognizing that okay, mental health is important. We need somebody to listen to us. We need somebody who's trained to be there for us to help us out. So that has really worked for the larger field of psychology. And now the scope of psychology is much more, the opportunities are much more, even for things like interning and remote work and those kind of things. It is much, much more than it was when I started with psychology during graduation, or when all of us also started. So at that time, the opportunities were limited. Psychology was like a fallback subject that if you don't get anything, you take psychology. But now I've seen that students are willingly pursuing it. They want to do it and they want to become psychologists. So definitely a good thing that has happened there. I think parents also are now encouraging students to take up this field, and they are also aware that okay, this is upcoming field and there is a need for psychologists. So yeah, I believe that is a good thing that has happened. Dimple, what do you think, since you teach young students every day? What is your take on
Yes.
it?
So during COVID, after COVID, I think I started my journey specifically in academics, and I have seen a flow of students which have raised. Before maybe let's say in a batch 90 would be entering, and which has doubled after COVID. So awareness in parents as well as in students also have raised that okay, this is a field which we can rely for our future, and we can work as a professional in this field. Yes, there would be a dropout, but the rate has been increased, especially for if we talk about psychology as a profession. Okay, and it has reduction in stigma is something which I have seen post COVID. This is one scenario. However, adding to that, if we see after COVID, after in 2002, if 2022, if you see, India has reached the peak population. Let's say we are at the highest state right now after at particular like we have crossed China's population rate also. So yes, the need for professional is needed, and this awareness has created more number of professionals coming out. However, there is one thing that some body should be there to regulate this particular field. So, which is one thing where we are still lacking, and we need to still push that getting more professional, but under a regulatory body would be more definite rather than having like huge number of psychologists and we have nobody to like we have no particular body to regulate. So that is one thing that I understood post COVID specifically.
So I think, Dimple, you have raised a very, very important point, and based on the others also what they have said. So after COVID, what we are seeing, we are actually doing really good in the terms of clinical and counseling practices, the psychology. So what I also feel sometimes that these fields have been skewed. And as per in the other, if you see the global scenarios, even in the other countries, the majorly the Western and other Eastern countries, and even the Middle Eastern countries, they have other sectors in psychology. So maybe that needs much more highlight in India, so that all the professions of psychology can get equal importance. And as Dimple, you said that regarding having a regulatory body. For clinical psychology, we already have Rehabilitation Council of India, but we need some other body which can actually overview all the domains of psychology and actually helping us to understand the purpose of each different domains of psychology and how they can contribute to the society. So, what are your take on this?
I agree with what Debelina has said that we do have a regulatory body RCI for one subfield of psychology, which is clinical psychology. But like she mentioned, there are so many other subfields. We have positive psychology, we have forensic psychology, we have school psychology, counseling psychology, and there are so many criminal and so on, like a lot and lots of fields are there. And if we talk about the global world, like the Western world, especially they have regulatory bodies for almost all of the fields and for almost each state. So within their country, different states will have different regulatory bodies, and there are people in place where whom you can approach. There are certain courses that you can do, and you get regulated and authorized, and those kind of things do happen. But sadly, in India, that happens only with clinical psychologists. So it is only clinical psychologists who get a license to practice, and we get a license number or all other practicing psychologists like counseling psychologists, child psychologists, adolescent psychologists, and all of those. They unfortunately do not have a regulatory body as such, and they do not have any licensing numbers as such or licensing bodies as such. So I think that really needs to change, and some body should come up which at least regulates, if not any other field, then at least regulates the practicing field, so to say, such as where you actually go and meet people and sort of help to diagnose them and treat them and those kind of things. Of course, bodies are needed for each and every field of psychology. That is how you will promote that field, and that is how you will regulate that. But if not anything else, then at least with the helping profession part of psychology, regulatory bodies are much needed, and that is actually the need of our. Yeah. So, Shita, what do you think about this?
You're right. I mean, without regulatory bodies, it becomes very difficult to decipher what are the professional boundaries of each subcategory, right? So, what kind of work an industrial psychologist does, and what kind of work a clinical psychologist does, what kind of work is specific to a school psychologist, there tends to be a overstepping of boundaries in case of no regulations, no regulatory bodies. So, if that is clearly delineated, people can focus on what they are specifically trained to do, and there is no overstepping, right? So I think that is definitely really, really important in order to protect the title of psychologists as a whole, because everything happens as a result of a more subspecialized training. By and large, everyone who has completed a master's is a psychologist. So in order to protect that title, we really need a regulatory body for psychologists.
I do
Yeah.
agree with all of you. Let's say, if you are hiring school psychologists, if you are hiring organizational psychologists, what do you expect from them from their studies? So, a regulatory body can decide that this all subjects could be learned by them, which can help them to become a better professional, or they can practice specifically in that particular section. Okay, so if I am organizational psychologist, or I define myself as an organizational psychologist, where did I practice or where did I intern? That also matter. So yes, the regulatory body will help all the psychologists who are coming out after masters to understand that what do they need more, okay, so that they can get placed well.
That is
Right.
really a correct thing. So now, as we are talking about regarding like different regulatory bodies, there may be a common regulatory body for all the domains of psychology who will certify depending on the course student is choosing. Now, what is the need? Because apart from psychology, suppose there is engineering, there is law, and there are many organizations, etc., etc. So how we can be of help to them? How do you think? Like we do therapy as a clinical psychologist, or you can a counseling psychologist. We offer therapy, the assessments, and etc. etc. thing. But how we can actually attach ourselves with multiple domains, multiple fields all over across. You can say India, or you can say outside India, whatever. So what do you think on this?
I think it's much needed. It's like a interdisciplinary sort of thing where you apply the psychological concepts to other fields as well, law, engineering, those kind of things. So I think that will only happen if like all of us are saying, if there's like a particular regulatory body or more regulatory bodies which are in place. So maybe they can advertise this on our behalf that okay, this is what psychologists do, this is what the sub fields of psychology are. Like for instance, can work very well with law. Criminal psychologists also can work very well with lawyers and those kind of things. Even couple therapists can tie up with special courts and family courts and those kind of things. So that can happen if we have a good regulatory body in place, which can sort of promote psychologists and advocate our use to other professions. So that is the first thing, and the other is that even the recruiters. So, like we're saying that okay, lawyers can work very well with psychologists or medical doctors, MBBS and other kind of medical doctors can also work very well with psychologists. So these people who will hire psychologists, like the employers, the hiring people, they need to know that what exactly they are looking for. So, like Dimple was saying that if you're a school psychologist, then you will have a particular training. If you're organization psychologist, you will have particular training. So the hiring people need to be aware about what exactly they are looking for, what title it is that they want to go for, and who can best fit the role. So, like I said, if it's a lawyer, if it's a court that wants to hire psychologists, they should be aware that okay, we will go forward with forensic psychologists or criminal psychologists. What are forensic psychologists? What qualifications do they have? What do they need? How will they help us? What will be their job role? So they need to be aware about that. Sadly, in India, what happens is the hiring authorities are not aware. And even people who work very closely with us, like people in medical professionals, even psychiatrists, a lot of them are not aware what clinical psychologists do or what counseling psychologists will do or what organization psychologists will do. So they put out hiring calls in very ambiguous manner. They will put one title, but they will expect the role of another title. That is because they are also not aware. So that awareness at large has to be there, and that can happen if the government does some measures, takes some measures, or even by efforts of individuals. Like we are also making efforts to make people. So something like these kind of things have to be there, so that the larger audience gets educated about what are the different fields of psychology and what they should expect.
Yeah, you're right, Lipika. I've noticed that there is an unfair skewness towards clinical psychology. Even in the choice of students, a lot of students, when it comes to deciding on what their subspecialty is, a lot of them end up taking clinical because they think, because the impression is laid out in such a way that, clinical is somehow the more superior version of psychology. But as a clinical psychologist, I must say that that's absolutely not true. There are some things that clinical psychologists are specifically trained in, but that does not make clinical psychologists any better or any more advanced or any more similar to a medical doctor or nothing like that. There are specific qualifications for a clinical psychologist because they're trained specifically. Similarly, there are specific qualifications for a counseling or a school or a forensic psychologist because they have specific trainings. And this impression is so rampant, and this sort of this idea of clinical psychologists being more superior is very clearly seen even in hiring calls and advertisements, because organizations are hiring clinical psychologists, right? What is the purpose of a clinical psychologist in an organization, right? So there is a very grassroots level of misinformation, and it sort of just gets perpetuated in academia as well. Yeah.
Yes, like we need a specification again, as all of you have told, that we need some specification. What do you need as an organization? So, as Devalina was talking about integration, okay, like we can integrate some other field with psychology. So, let's say human computer interface is coming, or there are new researches which are coming where engineering and or cognitive aspect of psychology could be used in developing certain tools, certain AI tools. Okay, so yes, psychologists are needed everywhere. You can make, after let's say after masters, you can specialize yourself in a certain area by doing a particular course, by doing a hands-on training. Okay, then you can apply whatever you have learned in the practical. So this could be a way where we can integrate two fields together, and we can come up with a better option specifically for psychologists. Like we are not limited only to clinical, only giving therapy, only giving counseling, or only functioning in a certain area. It could be that people think that clinical is the safest area because we have a regulatory body, specifically in India. However, if government takes that initiative, or even organization, multinational company, if they take this initiative, a researcher, then only I think some change can happen in society.
That
Yeah,
is
absolutely.
totally true. And I think, Shida, what you were talking is suppose some organizations that we don't need a specialization of clinical psychology to be present.
Mm.
So whereas in that position, maybe an organizational behavior or maybe a industrial psychologist would have been a much better fit. So why
Yeah.
still they're hiring? So the first thing can be maybe lack of awareness is the very first thing what I feel. And the
Mm.
secondly, I understand because again an organization is consisting of normal human beings. They can
Mm.
eventually go fall into a decline into some sort of clinical issues or
Mm.
some clinical disorders. So in
Yeah,
that cases, referring it to a clinical psychologist. So a strong system of referral has to be there. So
absolutely.
once
Yes.
the specialists, like in the different domains of psychology, once they understand what is in their field, what is in their expertise, and if not, a good system of referral. So what will it happen? You don't have to hire everyone in an organization, and the system can be very smooth with referrals. So, and
Absolutely.
this
Yeah.
can only happen with awareness. And there is also a very important thing, organizations that do give out the ads regarding hiring a clinical psychologist without having the proper desired qualifications. So we know in India, to be called as a clinical psychologist, one should have a degree of MPhil in clinical psychology till now. Now the
Yeah.
system is changing, evolving, so a new nomenclature system is coming up. We are not integrating that right now. But till now they will ask for a designation of a clinical psychologist and they're asking for master's or MSc or MA in clinical psychology. But these two are
Mm.
very different.
Yeah.
So I would really like to know how we can increase awareness. So what are the things? We know social media campaigns are there. There are many people who are doing their job. But how we can actually make it possible? Like proper awareness, how we can spread amongst organizations and to the non-psychological market.
I think a hiring advisory board would really help. Dimple, what do you think about that? Please elaborate.
Yes, yes, no, you can go ahead. I was also talking that maybe organization, especially educational organization, could be one of the major sector who can promote this. Like, till now, what I have seen, like during my education and after that, that we have 3 or 4 specialization given. Either you take clinical, counseling, OB, okay, and even in my institute, educational psychology was given at that time. We had 40 seats in master. After that, I have seen, okay, now new specializations are coming. Health psychology you can take in masters, or rehabilitation psychology you can take in masters. So these are few of the changes that I am seeing, or applied psychology is coming up. Okay, so maybe education or organization where you're studying would be one, or UGC could take that particular initiative, that we have this many specialization and or this many number of papers where you can go ahead. So as a teacher, academician, it could be their role, or it could be education's role, that to spread this awareness, that what are the career option after this.
Yeah.
Yes, Shweta.
Yeah. No, from what you're saying, also it makes a lot of sense because organizations or uh, academic organizations are giving subspecialization so that students have a more well-rounded perspective of all that there is possible. They do not intend for them to consider the students as, you know, being professionals in that area. For example, if an organization is offering rehabilitation psychology in their masters, it does not mean that once they graduate their masters, they are rehabilitation practitioners or rehabilitation psychologists. It just means that they have a general overview or general understanding of what kind of subspecializations you can go to. So masters gives you a glimpse of what you can pursue ahead. It's not a finalizing this thing, it just gives you a general overview of what you can do. And it is up to you and up to your career goals as to whether you want to continue working or you want to start further education. So it just gives you a glimpse of it. It does not give you any subspecialized training. Masters is a very general training, you know uh, a course of sorts. Yeah.
I agree with what Shrita is saying, that once you do masters, you just qualify to be a psychologist. That's it. Like, no fancy terms like counseling, clinical, or whatever. Nothing.
Hmm. Hmm.
You can of course practice as a counseling psychologist, but you just call yourself a psychologist and leave it there. So you don't use any other terms apart from that. But if you have a master's, fine, you've done the master's, maybe you've done some other diplomas or maybe some other certificates or other degrees, maybe like a PhD or some other degrees like that, then you can say that, okay, I'm specialized in this and this. So, like for clinical psychologists, you do MPhil, you call yourself a clinical psychologist. Similarly, if maybe you want to get into adolescent counseling, maybe you do certain diplomas or certain certifications
Mhm.
related to that, or maybe some get some experience in that field, and then you can say that I'm a adolescent counselor like that. But just after a master's, just doing it, just calling yourself fancy terms after master's is not really the right approach and not really what we want youngsters to do. I think coming back to the question that Devlina was asking, that how do we really spread awareness to the masses? So I will take this opportunity and bring the audience back to the goals of our venture. This is exactly why our venture was started, because we noticed that all of this is so rampant, right? Like the hiring authorities are not aware who they want to hire, what is it they're looking for. The students don't have these kind of proper skills to go and practice. There's overstepping of boundaries that is happening. So, keeping all of those things in mind, that is why we started this organization. And our organization is actually, the goal of organization firstly is to educate people, to increase awareness and to spread awareness to the masses so that they are aware of what is happening in psychology and they can hire better for the organization. They can refer better for themselves and for their friends and family. So yeah, that is this is our bit that we are doing, and I'm sure just like us, other people are also doing what they can do. But yes, more intervention at government level is definitely required, which can actually that is something which the masses will really follow. So as to say, if it really comes from the government agency. So yeah, that is much needed as
Okay. So, Shrita Dimple, what do you think regarding this? Because the purpose of whole FCN, the development of
Mm.
FCN is based on this, what Lipika said very correctly. So, what do you both think of this? How we
Dimple, would you
can,
like to go
yeah.
first?
Yes, yes. Purpose of FCN was yes to equip students specifically with the skills that are needed in the current setup wherever they are going for. So yes, that is where we see that there is a major gap, that students are learning theories, what is cognition, what is memory, but how to apply it. Okay, how to see it in a patient or how to see it in a client and help them to develop that particular skills. Let's say if you are working as an organizational psychology, if you want to go for organizational psychology, okay, so what are the training that you can give it to employees there, how you can do a hiring procedure. So there we are playing a role to help them to learn that skills, to understand how to ethically practice if you are doing clinical counseling, educational, anything. So this ethical domain we are promoting here, that okay, there are guidelines, you follow that guidelines, and with that you can show your creativity. That would be one way where FCN is playing a role. Yes, Shrita.
Yeah, and another thing that we principally stand with is continuous education. Just because you've completed a degree or you've completed multiple degrees, it does not mean that you can or you must or you should stop studying. You have to keep upskilling yourself. You have to keep learning about whatever is happening in the world currently, and you have to keep polishing your skills in order to best serve your clientele. And that's something that we stand with. So we offer upskilling videos, we offer upskilling webinars and courses that can help you become a better professional and serve your audience better. So
Okay.
that's also something. And also since we are completely online, we don't have any limitations of geography. We are available all throughout. So that's also something that represents access that we really stand by. Nobody should have to miss out on a opportunity just because they cannot reach it there geographically. So yeah, that's what
Okay.
FCN stands by.
So, we have received a few queries, like, is it only for the professionals, like the students, or the professional who have passed out, for example, who has done their, like, masters in psychology? Is it only for them, or there are people who is outside of the psychological field, for example, parents or geriatric population, because we have received the interest from them also. Whether we can conduct some sort of webinar, some sort of what I say workshop for them to upskill their quality of life. So, what do you think on this?
Yeah, absolutely. Community awareness is also something. Is a very important leg of FCN. We'll do work that in a sense is giving back to
Got it.
society,
Yeah,
right? So we do believe that sort of a work needs to happen, and we definitely will organize some kind of community awareness programs in which we are bringing out
hmm,
ethical information, accurate information out in the masses.
that is okay. So, I really thank all of you. So, it was a very nice uh, insight exchanging session. So, what do you think? What we can plan the next episode to be about? Any clue? Anything? Any hints from your side?
You tell
Knowing
us.
more about what psychologist or how can we become like psychologist
It's a
specifically.
good idea. I do agree on this. Actually, so focusing a bit on the nomenclature part to understand the divisions of psychology better, it will really help the budding students who are actually thinking of going in field of psychology or already in the field of psychology and the future education part. It's a very good idea. So then, team, see you all in the next episode.
Thank you
Yes.
so much,
Thank
Debalina.
you.
Thank
Thank
you
you
all.
so
Thank
Thank
you
you all.
so
We'll
much.
have more meetings like
Thank you
this.
for being here.
Sure,
Yes,
yes,
Thank
it was great
you.
talking to all of
yes.
you.
Take care.
Yeah.